Well, with the cold weather here pushing more people indoors, experts are urging you to take preventative steps by getting vaccinated, practicing good hand hygiene, and of course, staying home when sick. Joining us this morning, Dr. Paul Anthony, Assistant Director of Infectious Disease at Hartford Hospital this morning. Doctor, thank you so much for your time today.
My pleasure.
Did we get it right? Have to practice good hand hygiene. You must be seeing some of these flu cases start to tick up this time of year. Can you tell us what trends you're seeing so far?
Yeah, so right now we're seeing definitely flu is leading the pack, followed closely by COVID and then some RSV and everything else.
Now, we've been talking a lot about this morning. We're seeing cases in New York start to tick up, and that is sometimes an indicator that we may see more cases here.
That is true.
What are some common symptoms people should be looking out for that may tell you it's a bit more than the common cold?
Yeah, I think the issue is there's a lot of overlap, but generally speaking, if you start having fevers, you're coughing, you have the body aches, the sore throat that just won't go away, like that is indication of like more to come. And definitely, if you're having shortness of breath, that might be a reason to pause and maybe look for medical attention.
Yeah, exactly. And what about in children too? It's tough sometimes to understand what your child may be experiencing, and we can be awfully quick to call the doctor, I think, as parents. Is there anything that should tell us that it is time to seek medical help?
Yeah, I think, it's always better to seek the medical attention than wishing you did it a day or two earlier. So definitely, if you think you need the help, we should. But I think it will be the same thing. It's those high fevers, especially in the children, the coughing that just won't stop. Those will be some triggers to seek help. And of course, like you said, the shortness of breath piece of it.
All right. And what are some steps that families can take to protect themselves? Of course, we'd rather just get ahead of it, this flu and COVID-19 season during the holidays.
Yeah, I would say like the first thing is if you haven't received a vaccine yet, it's not too late to do so. Like I would urge people to do that, vaccinate, and then wash your hands, like you were saying earlier. It's a good vector for those viruses. So wash your hands, wipe out the high touch surfaces if someone's sick at home. And if you're sick, try to stay home to not spread the viruses. Cover your cough and your sneeze with your elbow, not your hand. And if you are in a crowded space that's poorly ventilated, like you were saying, everybody's indoors, remember the mask as well as a tool that can help cut down the transmission.
Sure. And what kind of advice do you have for people who still may be hesitant about getting the flu shot and the COVID-19 vaccine? There was a time when we were told to wait to get one when you're getting the next. And what would you recommend now? How have things changed?
Yeah, I mean, it's still the same. Is you can get them both at the same time, although like sometimes that may carry like increase your chance for side effects of those vaccines. And if you're not getting them together, you should space it out by 14 days.
All right, doctor, very good. And of course, when you get the vaccine, not always perfect. Again, still have to practice good hand washing, but you may still get the flu, right? Just could lessen the symptoms.
Could lessen the symptoms, and more likely you are less likely to die from the disease, which is, at the end of the day, this is what we all want.
All
Make
right.
sure you're around.
Well, stay safe and stay healthy, Dr. Paul Anthony. Thank you so much for your time this morning. Really appreciate all your tips and advice coming to us this morning. Thank you.